Good day. My name is Jonathan Ford, and I'll be presenting my article today. My article is entitled The Communication Skills and Quality Perceived in an Emergency Department, the Patient's Perspective. This paper was written by the author Munoz and others in the International Journal of Nursing Practice. The aim of the study was to see if a healthcare provider's communication skills affected the quality of care of ED patients. So the study starts off with talking about a background and that healthcare providers' level of communication is thought to possibly affect their quality of care. The design was a cross-sectional descriptive study done in an ED in a university hospital in Spain. Their methods were that the data was collected over 3 days in June of 2016. They had 200 participants, and then their inclusion criteria were that the patient's care was done by a healthcare provider in the emergency department. These were discharged patients and not admitted patients to the hospital. Now, the exclusion criteria were pediatric patients, psychiatric patients, and those who were critically ill. Data was done by using multiple questionnaires. And then the results. There was a positive relationship between effective communication and improved quality of care. After considering the context for the study, we're going to dive deeper into some of the critiques for this study. One of the things I found about the study that really made me think about its importance in healthcare is that we can actually improve the quality of healthcare without having to do any sort of expensive scientific breakthrough. We can just improve quality of healthcare by being better communicators. This is something that every healthcare provider is entirely capable of. I enjoyed the aspects that this study did in measuring healthcare quality and broke it down into 4 different parts. Problem solving, which is basically the ability for somebody to get the job done. Respect, which relates to the patient's autonomy and the patient feeling like they were a part of the healthcare team and the healthcare decision making. Lack of hostility. Hostility is an attitude that was sometimes given off by healthcare providers and nursing staff and healthcare employees that can make the patient feel that they're not welcomed or that their opinions don't matter. And then nonverbal immediacy. And what this is, these are our nonverbal gestures. These are things that we do when we're speaking to people or communicating with people that we may not even realize. Now, one of the strengths of this study was that it adequately defined and measured communication skills with the aforementioned 4 categories. And then it quantitatively associated this data with healthcare quality metrics. The study ended up finding that the biggest influences for improved quality in healthcare were respect, problem solving, and nonverbal communication. Now, the study did have some limitations, and the ones that were most obvious to me while reading it were that they only used convenient sampling. They had a very small study size. In addition, this was just one emergency department and one hospital in one town, and this was all done in one time of the year, only over the course of a couple of days. What you would like to see is something that is a prospective study that is done in different parts of the country across different socioeconomic categories, and one that is done through all times of the year, as different times of the year bring different sorts of illnesses to the emergency department. Lastly, there are some discussion questions I would like to propose. First of which is, what are effective ways we can train healthcare providers to be better communicators? Second is, how does cultural competency fit in with our communication skills? Thirdly, one way to improve nonverbal communication cues would be videotaping encounters. What patient safety and privacy concerns does this invoke, and are these concerns worth encroaching if it improves patient care? My last question is, how do we test for communication intelligence? And should it be a screening test like other entrance exams for graduate schools that train healthcare providers? So in conclusion, there should be further study into healthcare providers' communication, healthcare quality, and possibly further screening of healthcare providers prior to professional school to assess communication intelligence, as this could be big benefits for improving healthcare for patients.